Hi everyone, my name is Kristen Johnston and I'm the Chief Nursing Officer at Massive Bio. Today, February 28th, 2021, is Rare Disease Day. In an effort to help raise awareness of rare diseases, which affect 300 million people around the world, we're going to talk briefly about myelofibrosis. Myelofibrosis is a chronic blood disorder that affects men and women in equal numbers. There are 1.5 cases diagnosed per every 100,000 people in the United States. Myelofibrosis causes extensive scarring to the bone marrow, disrupting the body's normal production of blood cells, which can be dangerous and cause unpleasant symptoms. There are related disorders that can lead to myelofibrosis, including polycythemia vera and essential thrombocythemia. Patients with these disorders have the potential to develop secondary myelofibrosis, whereas those without these disorders can develop primary myelofibrosis. Some risk factors for developing myelofibrosis include being of older age, exposure to certain chemicals, having a JAK2 mutation, which is common in about 50 to 60% of people with myelofibrosis, and a CALR mutation, which is found in approximately 25% of people with myelofibrosis and essential thrombocythemia. Symptoms of myelofibrosis may include feeling tired, weak, easily bruising and bleeding, excessive night sweats, fever, bone pain, itching, and susceptibility to infection. Treatments for myelofibrosis include Jakafi, also known as ruxolitinib, which is the first drug that has been approved by the FDA to treat myelofibrosis. It targets the JAK2 gene, which, as we mentioned, commonly mutates in about 50 to 60% of myelofibrosis patients. Another treatment, Inrebic, also known as fedratinib, is a drug that targets the JAK2 gene. The only curative treatment right now for myelofibrosis is an allogeneic stem cell transplant, which requires stem cells to be transferred from a donor to a patient, although not all myelofibrosis patients are eligible for that. And then there are clinical trials, which is where Massive Bio comes in. We can help patients with this rare disease. Novel treatments are being studied in clinical trials, and a lot of patients might not know that that is an option for them. Jakafi, the first approved drug by the FDA to treat myelofibrosis, completed a clinical trial, and we are hopeful that there will be more like it in the very near future. What Massive Bio does for patients is help them find and enroll into clinical trials that are right for them. We have an AI-based clinical trial matching system which pre-screens patients using more than 100 data points for trials across the United States and other countries. It also finds trials for patients that are eligible near their home. We then help the patient enroll and handle all of the logistics associated with enrollment in order to take some of the burden off the patient and their family. Even if patients aren't eligible for a clinical trial today, just by getting into our database, we can reach out to you if they're eligible for one in the near future. If you're interested in clinical trials that you may be eligible for, or just getting into our database to be prepared for a day where you might need more options, contact us today.